Hi, I'm Dr. Jim Keneally, and I'm one of the ear, nose, and throat specialists here at Reliant Medical Group. A lot of parents have questions about ear tubes. Why do children need them? How do you put them in? And what the benefits and risks are. Let's start by talking a little bit about why children get ear infections to begin with. This is the middle ear. This is the ear canal, this is the eardrum, and this is the middle ear space. There's a little tube or channel called the eustachian tube that goes from the middle ear down to the back of the nose. This is what pops when you go up an airplane or an elevator. This regulates the pressure between the inside of the ear and the rest of the world. In little children, this eustachian tube is narrower because they have smaller heads, and it comes out at a flatter angle, so it doesn't work as well. As a result, negative pressure can build up the middle ear space, and that literally sucks fluid from surrounding tissues. That can do one of two things. One is the presence of fluid in the middle ear space, where there should be air, keeps the eardrum from vibrating normally and can block the hearing. This can result in temporary hearing loss along with speech and language delay. In addition, the nice sugary and proteinaceous fluid in there serves as a good culture medium for bacteria. They really like to grow in there. And that can result in recurrent ear infections. Now, fortunately, children's heads grow faster than the rest of their body. So the eustachian tube gets bigger and it gets at a better angle. And as a result, most children outgrow the ear problems around age 3 or 4. However, between then and when they're first born, they can have a lot of ear problems. And that's where the ear tubes come in and where they can help. What an ear tube is, you make a little incision in the eardrum. If there's any fluid, you suction it free. And you put a little tube in there that looks like the hub of a wheel. That allows the air to come in and out through the ear canal rather than depending on this very narrow and undependable eustachian tube. The tubes usually stay in about 6 months to a year and a half, with a year being average. And that allows the child to outgrow the ear problem naturally. Most children should outgrow the ear problems around age 3 or 4. If they don't, you start to think of other causes. Those causes can include allergies, because that keeps the nose congested and stuffy, or large adenoids, which sit right here in the back of the nose where the eustachian tube comes out. In the old days, we used to tell parents not to get water in the ears because the water could get through the tube and cause infection. However, we've since found out that we don't need to keep the ears dry, and your child can go about their normal activities without any problems. What's involved with surgery, it's a same-day procedure. It takes about 15 minutes to do. The children are put under with a mask only. They don't usually need any IVs or blood draws or anything like that. While they're under anesthesia, you make a little incision in the eardrum and you put the tube in. The children usually go home a good half an hour or so after surgery. There is minimal pain, nothing that won't be taken care of by Tylenol or ibuprofen or Motrin or something like that. We often give the children ear drops for a few days to prevent any blood from clotting in the tubes. And other than that, there's no care. So that's a summary of ear tubes and their role in children.